Hi, this is Arvind. The topic that I have taken up is clinical decision support system for diagnosing multi-drug resistant tuberculosis and extensively drug resistant tuberculosis. First, let me give a general idea about what tuberculosis is. Tuberculosis is caused by infection with bacteria, Mycobacterium tuberculosis. Almost 1 in 4 people in the world are infected with TB bacteria. TB can usually be treated with a course of 4 standard or first line anti-TB drugs. They are isoniazid, rifampin, and fluoroquinolone. In this assignment, we will focus on multi-drug resistant TB and extensively drug resistant TB. The reason I chose this because it is extremely difficult to diagnose MDR-TB and XDR-TB even with modern technologies and laboratory tests. Let's see what MDR-TB and XDR-TB is. MDR-TB is a form of TB infection caused by bacteria that are resistant to treatment with at least two of the most powerful first-line anti-TB medications, isoniazid and rifampin. XDR-TB is a form of tuberculosis caused by bacteria that are resistant to some of the most effective anti-TB drugs. XDR strains have arisen after the mismanagement of individuals with multi-drug resistant TB. MDR-TB and XDR-TB raises concerns of future TB epidemic with restricted treatment options and jeopardizes the major gains made in TB control and progress on reducing TB deaths among people living with HIV or AIDS. It is therefore vital that TB control be managed properly and new tools developed to prevent, treat, and diagnose the disease. Let's discuss about what are all the major causes of MDR-TB and XDR-TB. Currently, the majority of multi-drug resistant cases of TB are due to one strain of TB bacteria called the Beijing lineage. As we seen in the earlier slide, TB should be treated with a course of 4 standard or first-line anti-TB drugs. MDR-TB can be caused by prescribing wrong medications, use of only one medication, while the standard treatment is at least 2 drugs, and another cause is not taking medications continuously during the treatment period. XDR-TB can develop when the second line of drugs such as amikacin, kanamycin, or capreomycin are also misused or mismanaged and therefore also become ineffective. Now, let's have a look at the various symptoms of multi-drug resistant tuberculosis and extensively drug resistant tuberculosis. Symptoms of MDR-TB and XDR-TB are no different from ordinary TB. The major symptom of tuberculosis is a cough with thick, cloudy mucus, sometimes with blood. For cases more than 2 weeks following other symptoms, patient might have fever, chills, night sweats, fatigue and muscle weakness, weight loss, and even shortness of breath and chest pain. As we know, it is extremely difficult to diagnose MDR-TB and XDR-TB even with modern day technologies and laboratory tests. So it is essential to develop new tools to diagnose as well provide valuable information such as anti-TB drugs to cure MDR-TB and XDR-TB. I have designed a clinical decision support system which is mainly aimed for doctors. This clinical decision support system is used for diagnosing whether a patient is affected by MDR-TB or XDR-TB. After diagnosing if the patient is affected, the decision support system provides a list of anti-MDR and XDR-TB drugs that can be prescribed by the doctors. The DSS takes inputs from primary examination by doctors and various laboratory tests. The clinical decision support system diagnoses MDR-TB and XDR-TB with two steps: primary examination and laboratory test. In primary examination, the doctor collects patient history and the doctor checks patient if if he or she coughs with thick cloudy mucus, sometimes with blood. They are also checked for fever, chills, night sweats, fatigue and muscle weakness. Often the patient loses some weight and they are also checked for shortness of breath and chest pain. After the primary examination, if the symptoms of the patient is matched with that of MDR-TB or XDR-TB, then the patient's sputum is collected and a series of laboratory tests such as conventional culture-based methods, liquid culture-based methods, novel rapid phenotypic methods, novel rapid molecular methods are conducted. This flowchart explains the process or workflow of the clinical decision support system for diagnosing MDR-TB and XDR-TB. This is the concept map of the decision support system used for diagnosing multi-drug resistant tuberculosis and extensively drug resistant tuberculosis. It is primarily aimed to aid the doctors with the primary care settings. The inputs for the decision support system are the sputum, fever, chest pain, regular cough, and weight loss. The process first starts with the primary examination results, followed by the laboratory tests such as conventional culture based methods, liquid culture based methods, novel rapid phenotypic methods, and novel rapid molecular methods. The results from the laboratory tests are collected, after which the diagnosis is done by the decision support system. After diagnosis, the decision support system confirms the presence or absence of the disease. If it is present, then it prescribes the appropriate anti-drugs for multi-drug resistant tuberculosis and extensively drug resistant tuberculosis. This is the list of anti-drug classification provided by World Health Organization for MDR-TB and XDR-TB throughout the years. Let us discuss in depth about the list of anti-drugs that can be provided by our DSS to cure MDR-TB and XDR-TB. The World Health Organization classification of anti-TB drugs. Group 1. First line oral drugs. Isoniazid, rifampicin, ethambutol, pyrazinamide, rifabutin, rifapentine. Group 2. Injectable anti-TB drugs. Streptomycin, kanamycin, amikacin, capreomycin. Group 3. Fluoroquinolones. Ofloxacin, levofloxacin, moxifloxacin. Group 4. Oral bacteriostic second line anti-TB drugs. Ethinomyde, protinomyde, cycloserine, terizidone, para-aminosalicylic acid. Group 5. Anti-TB drugs with limited data on efficacy and/or long-term safety in the treatment of drug-resistant TB. Bedaquiline, delamanid, linezolid, clofazimine, amoxicillin, imipenem, meropenem, high-dose isoniazid, thioacetazone, clarithromycin. The limitations of this decision support system are as follows. The true scale of XDR-TB is unknown, as many countries lack the necessary equipment and capacity to accurately diagnose it. Even with highly developed technologies and laboratory tests, diagnosis of MDR-TB and XDR-TB may take up to 16 weeks. The second line drugs are more toxic than the standard TB regime and cause a range of serious side effects, including hepatitis, depression, hallucination, and deafness. This makes the patients more vulnerable and may also increase the mortality rate. Here are some of the references that was used to create this presentation as well as the decision support system. Now that we have reached the end of the presentation, I would like to thank everyone for their time. I appreciate any feedback on this which will help me to improvise in the near future. Thank you.